This original WSRE presentation is made possible by viewers like you. Thank you.
Why sleep is so important to our overall wellness. Dr. Hui-Ya, Gail on this edition of Conversations. It's no longer in vogue to brag about how little sleep you can function on. More and more evidence is suggesting that lack of sleep is detrimental to both our physical and mental health. This is true for children and adults alike. Dr. Hui-Ya Gail studies sleep. She is a visiting assistant professor of psychology at the University of West Florida. Her research includes why college students get sleepy during lectures, how nap deprivation affects children, and other issues related to sleep. We welcome Dr. Gail to Conversations. Thank you for joining us.
Yeah, I'm happy to be here too.
Our pleasure to have you. I'm excited about doing this program because I've been reading so much in recent years about sleep and just how important it is. Why did you personally decide to study sleep?
It went back to my first job. My first job actually was flight attendant, and then, flight attendant we need to flew across the different countries, and so it's like a shift of workers.
Right.
And then we start we got off maybe 10 o'clock p.m. and then flew from Taiwan to United States, and then just spend the 12 hours on the flight. Okay, and then the whole night I need to stay up. Mm-hmm. And then first couple months I feel okay because I was young and very energetic about the position. But after a couple months I find out, okay, my energy just reduced and then my body function actually just impaired. Yeah, the memory a little bit just lost like that. So then I feel I should change my career gear. Okay. Right. Yeah. Right. And so that's just the first seed. And then I just attend a graduate school in Taiwan, then finish my my program in master degree. And so then I want to just think about if I want to study further, what can make me have the lifelong passion, topic in psychology. And I find out sleep can be studied in psychology field, especially behavioral part. Right. So then I just go ahead to choose sleep.
Yeah. What is, you talk about that, and I think about flight attendants, I think about, police officers, firemen, and other types of shift workers.
Right.
And you...
Medical doctors.
Yeah. What can those folks do to help offset some of the issues that they have by working these odd hours?
There are several ways, but I will say the best way is don't stay up.
Don't stay up?
Yeah, definitely don't stay up. And then, or you need to have a full-time recovery from your sleep deprivation, at least 3 days. But for those occupation you just mentioned, the medical doctor, policeman, usually they don't have these long vacations for them to recover. Right. So
when they work off a long shift, should they go home and you say don't stay up, so immediately go to sleep?
Well, this is a one way. Okay, either they can just immediately get some sleep, but actually ruin their circadian rhythm. Okay. Yeah, but circadian rhythm should be adjusted slow in progress, not just one day. Right. Today you wake up at 7 a.m. and then stay up, and tomorrow you wanna sleep at night. So if you keep doing wake up in the midnight and work, you need a time to shift. It's more like, let me tell you. Sure. It's more like you have a jet lag, we have a 5 hours difference from the eastern coast to the western coast. Right. We'll say, how do you, in the end, just the old time, if you walk, or ride a horse from the eastern to the western, you don't have a jet lag issue. Right. Because your circadian circadian rhythm, actually adjusted day by day.
Right.
1 hour a day actually is optimal.
Okay.
1 hour. So today you can wake up at 7 a.m. Tomorrow you can wake up to just 8 a.m. So just 1 hour a day.
Right.
Yeah, and then by the time you arrive Western Coast, you got it.
Right.
You adjust your whole body to the Western.
Right.
Yeah.
But
so,
with jet, it's immediately you're over. All of a sudden, have to adjust.
So you need to. So then you need to manually adjust your body, like you need to create your whole bedroom environment as just as a dark room, and then when it's time, you need to just make you exposed to the light for sure.
Right.
So that's manually.
Right.
Yeah.
So, for example, the folks that are having like these rotating shifts, like for example, they may work overnights for 2 weeks and then they go. So that's a real challenge.
Very challenging. And then I would say basically mess up many things, many aspects. So you constantly sleep deprivation.
Right.
Okay.
Constant.
Constant. Because you should. When I was a flight attendant, I will try to. I don't adjust my sleep cycle. I only just make sure when I tired, I just go to sleep. But however, I will be sure couple hours before work, I need to get more sleep.
Right.
Even I don't feel
Right.
I need sleep, but I was lie on the bed to prepare for a job.
Right.
It's more like that. But so far, I will tell you, in terms of research result, there's no optimal way.
No optimal
No
way to do
optimal
it.
way to compensate their loss during the shift work.
Wow.
Yeah.
Interesting.
Yeah.
So, are some people more geared towards being what we would say is I'm a morning person or I'm a night person, and that's the whole circadian rhythm thing.
That's
too,
right. And it's true.
It is true.
It is true. It's a genetic influence. So, yes.
It's genetic.
Yeah.
Interesting.
And
Okay.
then, so we usually use a very easy survey, and then to ask you and then self-report out. We can roughly estimate you are morning lark person or night owl person.
Okay.
And then most people actually are just a median.
Okay.
Intermediate, not just in the middle. You thought you are morning person or a night person actually can be trained, can be adjusted.
Okay.
Okay. You will be surprised. The college students actually can be a morning person.
Okay.
And then yeah, but it's but we still have a few percentage of people. They are real lark, just a morning person or late owl person.
Okay.
And then, especially let's talk about teenager. Teenager, they tend to be just a night person, evening person.
Okay.
They do. They have a hormone. They have different hormone. They have a different after puberty period. They have a totally different situation. So yes, they have a official should be. They have a scientific backup. They can go to bed late and wake up late. Yes. Okay.
I can do that too.
Well, sorry, only for a teenager. When you become a young adult, your circadian rhythm shift back to should be more just to wake up in the morning and then go to bed around 10 o'clock. That is a normal for you now.
That's a normal person.
Yeah, but for teenagers, they tend to go to bed late, easily.
Mm-hmm.
And if some teenagers, they even will be diagnosed as DSPS, so delayed sleep phase syndrome.
Okay.
That means they cannot adjust themselves to wake up early, to go to bed early. They just need to go to bed late and wake up late.
Okay.
Yeah.
That's just the way they're built.
But the treatment usually is a light exposure, just to give them a light in the morning, and then dim light, a couple 2 hours before they go to bed.
Okay.
We'll try to shift their sleep period from the late to the earlier.
Okay.
Yeah.
Well, and seriously, like myself, I think of myself more or less as a night owl. Okay, and I can be during the day. I can say to myself, "Boy, I feel tired, and I'm going to go home and I'm going to go to sleep early tonight." And I will get home, and it's like about 8 or 9 o'clock. I just start kind of ramping up.
I know. Yeah.
So does that mean that I'm really a night owl, or is it just something else?
Something else. Okay, definitely. Because, well, it's actually related to related to sleep hygiene. We usually prepare for daytime activity, right? We don't prepare for sleep. We thought that sleep is a natural ability,
Right.
and I can sleep when I was baby, and then why do I need to prepare for that?
Right.
Yes, you need to. The whole time you actually need to control your activity and to prepare for that. Let's say when you wake up in the morning. Sorry, I just tell you the whole story.
Sure.
When you wake up in the morning, the first thing you should actually open your curtain and that your eyeballs accept the sunlight.
Natural light.
That's right. And then it will send a signal to your brain. This is the time you need to be alert and
Right.
wake up.
Right.
And then so the melatonin definitely reduced and all the system just on right now.
Right.
So sleep and wake, there's just like on and off like that. And then you need to prepare. So keep your activity and don't drink caffeine.
Right.
And then if you drink caffeine before noontime, usually research will say just early afternoon. But my thought is, well, okay, so just before noon, 12 p.m., you can finish your coffee.
That you should be done.
Yeah, and then of course, no soft drink, no Coca-Cola or something like that.
Right,
Okay,
right.
so then and then have a regular exercise. Okay, okay, and let me think. And when the time you just to finish your work and go back home, so you should actually calm yourself down and prepare for sleep. But most of the people will think, hey, it is my relaxed time.
Right.
I want to see movie.
Right.
I want to play video game.
Right.
Right? I
Right.
want to just browse social media.
Right.
And those are all screen time and then so stimulate your body. You should be active.
Right.
So usually my house is I try to use a natural light.
Right.
And then I will, when we eat dinner, we will just only have a very dim light, even from dinner, okay? Then when you brush your teeth, okay, don't turn on the spotlight, okay?
Right.
And then just a dim light still.
Right.
Okay, tell your body it's ready for sleep. And the temperature you should adjust,
Right.
okay? Some people, most of people, if they feel anxious, they should actually do some meditation or even just a simple breathing. Okay. Inhale, exhale, like that.
Right.
And then calm down. But we have a busy life, I understand. So
Right.
you worry about tomorrow's work and then you have an anxiety. So everybody just is anxious about, okay, tomorrow's pressure. And my suggestion will be write it down. Okay. Have a very short paragraph, just write down. Of course, no TV in your bedroom.
Right.
No, yeah. And then bedroom just restricted to sleep and this behavior.
Right.
Yeah.
That's interesting because once I decide I'm going to sleep, I'll go to sleep. So like when I decide I'm ready to go to sleep, it's easy for me to go to sleep. So it's not like I'm stressed out or anything like that. I just feel like my energy level comes up at night. I've always kind of been a night person.
You're lucky.
Yeah, I'm lucky, huh?
Yes. Yes.
So who typically has better sleep patterns or habits, men or women?
Well, women actually has a relative to male. They have a slightly larger proportion of the deep sleep. Okay.
Deep sleep.
That means more deep sleep, then you have a higher sleep quality.
Okay.
But also, so it's a mixed. But also, women has just a fragmented sleep. You know, just the sleep will be disrupted a little bit, and then they may wake up, in the middle of the night.
Mm-hmm.
So it's a mix. And then, but female are tending to complain and sleep more.
Okay.
Yeah. So it's we will say just a misperception of the sleep. They thought they did not sleep well. Sometimes in the morning, women complain. So I did not sleep well last night.
Right.
And so husband might just say, no, you snore or you sleep like like a baby, right? And then so they tend to underestimate their
How well they
sleep. That's right.
Interesting. Now, when we talk about things like sleep apnea, what is sleep apnea?
Okay, so sleep apnea, easy to say, it's like, there are two types of sleep apnea. The one type is the most common is just the obstructive sleep apnea. So we say OSA or OSA.
Okay.
So it's like, think about your airway has been blocked, okay, by your tonsil.
Okay.
That's a most common reason. And then so during the night you just sleep, and suddenly when you have the deep sleep, especially REM sleep, then your muscle will relax to the just relax, and then your tonsil, that's a muscle, part of muscle, and will just kind of like collapse and lie down, lay down, and then so block your airway, and you will and then like a choke, and then you wake up and breathe.
Okay.
But you don't know about that. You are not aware about that.
Okay.
And then you sleep, and then repeat it again and again. And so we call that event. That event can occur like 100 times within 1 hour.
Within an hour?
Yeah.
Wow.
In a severe case. Wow. So you think, how can you have a relaxed, restorative, sleep in this situation?
Right.
Yeah.
How would someone know? I know you eventually get a sleep study and you're
Right.
diagnosed with that, but before you do that, are there any signs that, hey, I may be having this issue?
Snore.
Snoring?
Usually, because if your volume of snore is really loud, and then constantly have that, and then usually has been reported by your sleep partner. Okay, like I cannot stand for his snoring or her snoring.
Right.
And then this is one very just a regular and a significant sign, and also daytime sleepiness. You cannot just maintain your alertness, even during driving, even talk to people, or seeing the movie. Even the movie is interesting, but you fell asleep. Okay, that's a just a very clear sign. You should go to see a doctor, because normally your nighttime sleep can support your daytime activity for sure. Okay, at top of maybe you take a nap, but you will find out sleep apnea patients that even take a nap, they don't feel refreshed. Okay, so think about it, during that event, even you slept for 9 hours, 10 hours, you actually even feel more tired, because you try to fight with that.
Interesting.
Yeah.
Interesting. So if you're tired during the day, and then maybe you go get it checked out.
And the snoring, yes.
Snoring.
And also, if you have a family history, like your father or mother has that, you probably want to check that for sure.
Are some people more susceptible outside of family history type stuff? I've heard things like maybe a diet. Does diet make a difference? Exercise, that kind of thing?
Okay. If you obesity, if you are overweight, that will make your neck here, is bigger. Then actually, so your tonsil is bigger, will easily block the airway.
Okay.
So just lose weight will be one self-cure, self-treatment.
Right.
And we also do, if you have a mild sleep apnea, and we will suggest, because you lie down on your back like this, you block your airway. But what about you sleep on your side?
Right.
Yeah, that will work. Yeah, that will work. But you cannot just keep your sleeping position all the time in this way.
Okay.
Yeah. So we actually suggest people to just saw a tennis ball
On their back?
Yeah, and because when you sleep on the back and it's not uncomfortable, so you will spontaneously switch to the side position.
Okay.
Well, but some people still can ignore that. But if you have a mild, okay, I mean just under that. That means the frequency of an event is under certain criteria.
Right.
Okay.
Right.
What I remember is 15. Okay. So within an hour, and then you basically can do several things like exercise and reduce weight, and then adjust your body temperature.
But if you think you're really missing out on it, go see a doctor.
Yes, for sure.
For sure. So there's been a lot of studies and information that has come out that lack of sleep causes problems both physically and mentally. Talk a little bit about that. I mean, like long-term stuff, right?
Okay. So when we think sleep is important, right? But how do we know that? We usually take out of a sleep to see what's the negative consequence,
Right.
okay, it caused. So so far we know it impaired your cognitive function. So you definitely reduce your attention level, and your immune system actually is reduced.
Immune system.
Yeah, and also decrease the pain threshold. That means you are more sensitive to pain.
Okay.
So we always say, if you wanted to see the dentist tomorrow, have a good night's sleep, or you feel more pain tomorrow. Okay.
Interesting.
And then
Interesting.
Memory loss. Okay, you cannot have a good memory in the concentration in the performance. That's a more like a behavioral part. And so there's one interesting thing. I want to tie it. So tie the sleep deprivation with the psychiatric illness.
Right.
Yeah. Okay. So so when you sleep deprive, you actually accumulate your beta amyloid, okay, in your brain. And then why we say that? Because one important function of a sleep is try to clean the brain waste.
Right.
Okay, that's a pretty new study result.
Right.
And so we only do the house cleaning job during sleep.
Okay.
So if you don't sleep, if you stayed up, that means you just miss one opportunity to clean the waste in your brain and accumulate the beta amyloid. And then beta amyloid actually is so like accumulation of beta amyloid is a preclinical symptoms of Alzheimer.
Okay.
Right. So that's really just to indicate just early stage of the development of Alzheimer.
Okay.
Yeah. And not only that, we also find out if you sleep deprived, you actually will turn on one gene and make that gene mutate. Muted, and then that will smash your sleep pattern. So that's all connected. And then it's not like you sleep deprived one night and you think about, tomorrow I have a whole day, I can recover that sleep. But no, you already missed that and accumulate the possible symptoms. Yeah, so actually it's a very severe. I always try to tell my students just don't think about you can do it, because you can stay up and feel there's nothing. I mean, I don't suffer from the consequences next day, but you don't know what this sleep deprivation do to you, okay, in your brain. Right. And then, yeah.
So it's like I mentioned at the top of the show, the whole idea of, I can sleep when I'm dead, so to speak. I'm going to, that old saying, right?
Actually, yeah.
Yeah, I mean, that's just bad advice. I mean, no matter how tough or macho or whatever the case may be that you think you are, it's important to have your sleep.
Right.
And it can cause all kinds of issues beyond what we would initially have thought.
Yes.
Yeah, that's amazing, the research coming out. What advice would you have to someone who is feels like that I'm just out of whack, I'm not sleeping well?
Okay.
I mean, obviously go to the doctor and that type of thing, but any other advice? I mean.
Okay, I would say, so self-monitor yourself first. Okay, like have a very brief sleep journal to record when you go to sleep, when you wake up. And then after 1 week, you may be surprised. Okay, find out, oh, I always wake up in the middle of the night for 20 minutes and go back to sleep or something. That's the first step to do the self-awareness. Find out your sleep health. It's good or not. I mean, if you really have the good sleep health, that congratulations. That's good. Keep that. But if you find out something, then figure out what made you wake up in the middle of the night, or what caused you always take 30 minutes to fall asleep. Okay, not instead of the 20 minutes, or we always say 15 minutes it will be the best. Okay,
15 minutes.
Yeah, if you fall asleep within 5 minutes, that is the sign of a sleepiness. That means you are lack of a sleep because you fall asleep too fast.
Okay.
That means you desperately need that.
Okay.
But so like 10, 15, it's normal.
Okay.
So sleep log.
Sleep log, good idea.
Yeah.
Good idea. We've only got about 2 minutes left.
Okay.
So what are, as you look forward, what are some of the other things you're going to be studying? What intrigues you about the whole science of sleep study?
Right now, I'm very interested in the relationship between the sleep deprivation and stress. Yeah, and especially the attitude towards stress. Yeah, so, because you can have, let's say, how do you feel about stress?
Personally?
Yes.
I feel like I manage it quite well.
Okay, so is it positive or negative or actually neutral?
I've got about 1 minute, but I would say probably neutral. I mean,
Okay.
yeah.
So we will say whatever your attitude towards stress is a positive, and then positive, and then you don't need to cope with the stress. You just feel stress is a good friend, like that.
Right.
But when you sleep deprived, okay, you actually elevated your stress level.
Okay.
And then how would you change? Maybe you will change your attitude towards stress.
Right.
Okay. And then shift the positive to the negative.
Okay. Interesting.
That's yeah.
Fascinating. Thank you so very much for coming by.
Thank
it was
you
a
so
pleasure.
much.
I wish you all the best.
Thank you. Okay.
Interesting conversation about sleep. By the way, you'll be able to see this program along with many other programs at WSRE.org/conversations, as well as on YouTube and Facebook. I'm Jeff Weeks. Thank you so very much for watching. I hope you enjoyed the broadcast. Take wonderful care of yourself, and we'll see you soon.
Support for this program is provided in part by Gulf Power, a Southern company, and by viewers like you. Thank you.